foamrolling for your hips and your knees. To start, you want to target your glutes. So sitting on a foam roller, you can go back and forth targeting one glute, but ideally you're angled on that glute and you're bending the knee on that side so that you can really get into that area. So foam rolling is intended to put pressure on the fascia. So the fascia is the like saran wrapped type of material surrounding your muscles, and you're trying to put pressure on that so that it will demand that to relax and to release and to get more blood flow into the tissues of the muscles that you're targeting. So getting into that glute, you're just going back and forth a couple inches, getting the whole area. So you're doing your closer to the sacrum. You're going to go out towards the outer part of your glute, and you're just foam rolling the whole muscle. Once you've done that, then you're going to lower it down into the hamstring. So the hamstring, you start right at your sits bones, and you're doing a couple inches there. You can do exactly right under the thigh, going a couple inches back and forth, all the way down till you get to the knee. You're doing a couple inches back and forth, and then you're going to go to the side. So you get the outer thigh, the back of the hamstring on the thigh, going back and forth. Again, you're just doing a few inches at a time, starting from the top, and you're working your way down to the knee. Once you've done the outer thigh, then you're going to go more medial, turning your leg in, turning your knee and your foot in. Again, starting at the top, working your way down so that you go all the way down to the knee. Once you get to the knee, you can reposition it so that you're gently working that. Sometimes you'll find a very tender spot and you just want to hold that there, hover over that. You can also bring your foot back and forth, but you're trying to get more blood flow into the area. You're also putting that pressure again for the fascia, just trying to find those tight spots that are uncomfortable and binding up your joints, causing pain. So you're just getting some small motion into that area, especially behind the knee. As you've worked your way from here, you can keep on going down to the calf. So you're working the calf muscles, going back and forth a couple inches, easy to do, and then you go all the way down. Now with the calf, you can always put your other leg on top of it, and that gives you some added pressure. A little harder to do, but it's very effective. And you can find those deep knots that are in there and help to get some pressure into that area. You'll notice it starts to release after a little while. So each muscle group, ideally you're aiming for 2 minutes per muscle group. You go all the way down till you get to your Achilles tendon and just work that area too. Now from here, I like to just go all the way over, and you're going to do your shin. So working on the knee, the muscles of the knee, you really want to make sure that you get the anterior compartment of your tibia. And so you're gently doing the muscles of the tibia. You're working the side part right here. You're not going on the bone. That hurts. You're just going to the side of that. And so as you can see, you're just holding your body so that you can control the pressure that you put on there. You're going back and forth a couple inches at a time, all the way up. And then you're stopping at the kneecap. The kneecap doesn't ever feel good when you're foam rolling it. And then you go up to the quads. Now the quads, again, you can go straight on, going back and forth, but you want to go to the side as well. You don't want to forget any part of that muscle, and then you want to go internally. So those are very helpful. Now from here, you can go to the IT band. If I turn on my side, you can see how you can support yourself with one leg, just foam rolling all the way from the top of the IT band, all the way down to the knee. I'm going to switch over so you can see as that continues. Now I'm on this IT band, continuing this way. Now the femur, the bone doesn't feel good to foam roll that. So go above that, and then you're going to get your TFL. And that's another good thick muscle group that loves to be foam rolled and demand more blood to flow into there. So you've got most of your muscle groups. Now the last part is your inner thigh, and that's a very awkward position to get into. But as you really loosen up that spot, it's very effective. So let me try to get into a position that allows me to do that. So you're bringing your leg out, and again, you're just doing a few inches at a time. Here I'm doing opposite. I'm starting from the knee, but I can work all the way up, but this is an awkward position. So as you continue to go, you can feel tighter and tighter spots. And the more that you have better flexibility, it allows you to get deeper into that area so that you can even have more flexibility. So keep on working at it, and the more you do, the better off you're going to be. So ideally, you're doing 2 to 3 minutes per muscle group. Let me recap. You're starting with the glutes, going to the hamstrings, going to the back of the knee, going to the calf, all the way down to the Achilles. Then turn over, you're doing the front of your thigh, the front of the shin, skipping the kneecap, going to the quads, but doing the quads front and inner and outer part. And you also want to do the IT band, your TFL, and then finish at the very, very inner thigh. And so that really helps both the hips and the knees, and you want to spend a good 10, 15 minutes per leg, and you'll notice a big difference. Do that a couple times a week. It's very, very effective. This is foam rolling for the lower body.